Hi and welcome back. I'd like to talk to you about sciatica, what it is and what causes it. The reason that got me thinking about this is because I had a patient come in to me recently and said, I've got sciatica, it needs to be treated. And it wasn't sciatica at all. That was not the cause of the pain. As a pain specialist with more than 20 years experience in a pain clinic that has now treated over 22,000 patients since its inception almost a decade ago, we know a thing or two about assessing pain. We know a thing or two about managing pain. So let's dive in. A lot of people, you go online, they say to you, sciatica, senior sciatica stretches, sciatica solutions, physio for sciatica, stop sciatic pain, latest treatments for sciatica, and the list goes on, and you're really bombarded with stuff. The one that I found quite interesting was, let me just see if I can find it, stop sciatica in seconds. How do you know how to treat sciatica if you don't know what it is and if you don't know what the cause is? So when you see this stuff online, number one, make sure it's coming from somebody with the appropriate level of expertise and experience and knowledge and training, not from, I say this with care and respect, but not from a random person. Make sure they are a doctor with the appropriate qualifications, with the appropriate experience. So I want to talk to you a little bit about sciatica. What is sciatica? And this is the key. This is the most important thing about understanding sciatica. It is a very loose term. It can mean a lot of different things to different specialists, to different providers, to different patients. Sciatica is pain that radiates along the sciatic nerve, which runs from the lower back through the glutes, through the hips, and down the leg. It can happen on one leg, it can happen on both legs. There are different descriptions of sciatic pain, but essentially it's anything that triggers pain in that area is termed sciatica. So there is no one type of sciatica. There is no one cause for sciatica. There are many causes for sciatica. And that's why it's so important to have the appropriate assessment and the appropriate diagnosis. Because if sciatica is caused by disc prolapse at L5S1, that is moderate to severe with weakness, with bladder problems, that requires decompression surgery, which is completely different to sciatica caused by muscle trigger points aggravating the sciatic nerve. So, for example, the piriformis muscle can aggravate the sciatic nerve. So you've got to be able to make a diagnosis before you can apply the treatment. That is why 5 minutes of exercise is not going to cure anyone with sciatica, or everyone, should I say, with sciatica. So what are the common causes of sciatica? Well, number one is disc herniation. So a disc can herniate anywhere around the lumbar spine. It can trigger, push, compress nerve, compress neural exit foramina, and cause neuropathic leg pain, compression of a nerve, herniated disc. Number two, spinal stenosis. That's where there is a narrowing in the spinal canal caused by many factors. It might be a disc herniation, it might be big swollen facet joints, it might be big swollen ligamentum flavum, it might be a combination of all of that. So spinal stenosis can cause sciatica. It's a different cause. It requires a different treatment. Piriformis syndrome, which is piriformis muscle, is the muscle that runs across the lower back. The sciatic nerve is closely related to the piriformis muscle. Sometimes the muscle can aggravate the nerve and trigger sciatica. It's not very common, but it can absolutely occur. Number four, spondylolisthesis. This is where a vertebra might slip forward on another vertebra and stretch some of the nerves. It can also cause issues on the facet joints, which might give you some pain. Doesn't radiate down the leg, but sometimes even a facet joint pain can mimic sciatica. Number five, degenerative disc disease. So the discs themselves can become swollen, can become inflamed. The bones around the disc can become swollen and can become inflamed. And that might give you symptoms that mimic sciatica, but it's not sciatica. This is degenerative disc disease. Trauma, injury to the sciatic nerve, or injury anywhere in the lower part of the body or the lower back can trigger sciatica. Now, of course, anywhere along the course of a sciatic nerve, if there's something that triggers the sciatica, the sciatic nerve, it can cause sciatica nerve pain. Infections, tumors, metastases, so the really dangerous medical conditions can also cause sciatica. Again, it depends on the clinical situation. If you've got somebody that's elderly, that's losing weight, that's had a previous history of cancer, for example, prostate cancer, and now they're getting back pain, sciatica, you've got to ask yourself, is this a factor, an issue from the previous or current prosthetic surgery causing bone metastases in the spine, causing a sciatica-like picture? So the situation is very important. The context is very important of sciatica. There are many other factors that give you risk factors for sciatica: sedentary lifestyle, being overweight, poor posture, heavy lifting, repetitive work, diabetes can affect nerves. Other factors can affect nerves, which can trigger sciatica. Peripheral neuropathy can give you sciatica. It's a different to true sciatica, but it might give you sciatic-like symptoms. So I'm just going to end off by telling you when you need to see somebody for sciatica. If the pain is severe, if the pain is relentless, if the pain is not going away, with simple measures such as simple analgesics, simple pain medications, simple stretches, exercises, consider seeing somebody. If you have numbness or weakness down the leg, consider seeing somebody. If you have loss of bladder control or loss of bowel function, consider seeing somebody. Some of those things are urgent. See a general practitioner. In some instances, you might even present to an emergency department following a trauma when you've got a possible fracture on your spine causing pain down the leg. So there are many reasons why sciatica might be a problem. I hope this has given you some information on sciatica. We'll come back with some treatment options. But again, the treatment options depend on the cause. Without understanding what the cause is, there is no point in applying some activities and exercises for somebody that's got a nerve root compression, or is no point in applying some of these activities and exercises for somebody that has got a tumor pushing on the sciatic nerve. So again, good expert that understands a good assessment, a holistic assessment, a whole patient assessment, sometimes investigations. And then once you understand why it's happening, once you understand the patient, then you can apply the appropriate treatments.